Are you planning for total knee replacement surgery? If you are planning to do so, you need to take the decision, and the decision involves two important facets. Financially, how much it will cost, and which implant will be used. So, in this video, I will break it down in simple language so that you can plan your total knee replacement according to your budget and take informed decisions. Namaskar, I am Dr. Prasun Sanyal, consultant arthroplasty surgeon. So, let's talk first about the financial aspects. The total knee replacement surgery throughout India, it can vary the cost according to the cities, but usually it spans between 2 lakhs to 4 lakhs or even more depending upon the hospital you are getting treatment from and the type of the implant used, whether the robotic surgery is contemplated or not. So all these parameters usually influence the cost of the surgery. Now, the most important facet for undergoing total knee replacement surgery is that to have a good health insurance policy which will cover up most of your expenses. Normally, to avail the total knee replacement surgery, the policy duration should exceed more than 3 to 4 years or presumably 5 years. So, speak with your insurance agents regarding the insurance type and variety so that you can avail the best from your insurance. So, if we split or categorize the expenses in a total knee replacement surgery, it falls into four broad categories. First is the most expensive part, that is the implant, which can cost depending upon the implant which is being chosen. Secondly, the hospital stay, the hospital OT charges, the medicine and the consumable charges, and if ICU facility is required after the surgery. Thirdly, it is a surgical team charge, which includes the surgeon's fees, the anesthesiologist's fees, and the surgical assistant member charges. And fourthly or lastly, the physiotherapy, which is in-house physiotherapy by the physiotherapist, and post-discharge physiotherapy at home after the patient is being discharged. Most of the expenses are usually covered in the insurance plan, including the physiotherapist's fees and the domicile treatment. So, talk with your insurance agent regarding the insurance you are availing. Now, let's talk about the implant. The implant is the most important part of the total knee replacement surgery. So, the implant in the total knee replacement comes into 3 or 4 components. One is the femoral component, one is the tibial component or tibial base plate, one is the ultra high molecular polyethylene which sits in the tibial base plate, and rarely we contemplate the patellar resurfacing. So, the implant can be of various metals and alloys, which is most commonly the femoral component is of cobalt chromium or rarely oxynium or titanium nitride coating. The tibial component is usually nowadays the titanium alloy, and the plastic is usually the ultra high molecular weight polyethylene. Few companies have come up with a vitamin E doped polyethylene to improve the longevity of the implants. Some total knee replacement designs have high flex knees for increased mobility, and as I mentioned, there might be vitamin E doped polyethylene also. Usually the cemented total knee arthroplasty is a gold standard, but before you are proceeding for total knee replacement surgery, always inform your surgeon about any metal allergies or any nickel hypersensitivity, because it will help him to choose the proper implants for you. So, in these cases of metal allergy or nickel hypersensitivity, usually the oxidized zirconium or oxynium implant is chosen. The implant will be selected as per your age, your level of activities, your body weight also. Because in obese patients with a high BMI, we need to use an extender or stem or with a constrained poly to improve the longevity of the implant and to prevent the early loosening of the implants. Now, in the modern days, all the implants which are used in total knee replacement, these are MRI compatible, and you will always get a document if you require during your passage during the airports. On an average, all modern day knee implants usually last around 12 to 15 years with a 90% survivorship, and it can last even more if the patient is also very much aware and follows the instruction of the surgeon. So, always consult with your surgeon regarding the which type of implant is being used, what is the ODAP rating for that implant, which is a internationally acclaimed rating system for the implants being used, and what is the usual survivor data which is available for that implant. So, before going for the TKR, always inquire about the estimate certificate which is given by the hospital about the cost, which implant is going to be used, And check with your insurance whether it will cover all your expenses or not. Planning ahead of the surgery, especially the financial aspect, it keeps you stress-free and it ensures you a smoother recovery. Stay tuned for further updates.